Dr. Siqueira, please, from DNDi.
Everybody does that. So, good morning to all. So, thank you very much, Stephen and Adam, for the invitation for this great meeting. I will talk on behalf of DNDi, so the Drugs for Neglected Disease Initiative and the Dengue Alliance, which is a South-South collaboration to prevent dengue deaths worldwide. So Jenny already tackled this issue. Why do we need treatments, and gave many reasons. We are relying on the clinical management guidelines, on fluid administration, but we've seen more and more outbreaks everywhere. And I'd like to bring this data from Brazil. It has already been talked about. So in the south of Brazil, there was no meaningful transmission of dengue until 4 years ago. In the last 2 years, especially, there was a very important transmission, and that was met with high lethality amongst elderly individuals who bear most of the deaths, although not contributing with most of the cases. There was a lot of deaths. It's primary infection, and it's also related to the lack of preparedness and experience of the health system to deal with dengue cases. So this is a situation that might mirror what may happen in other areas where dengue is being introduced, where there is lack of a clinical experience and also a high proportion of elderly individuals with comorbidities. And we are taking an integrated approach for dengue. We need vector control, as it was mentioned. The vaccine progress has been exciting, but there are still gaps, and mainly in therapeutics. We don't have a treatment so far, and we are likely to need them for the next decades as we will be facing dengue outbreaks. And then I would like to tackle a little bit of the topic of this session on how to move towards this scenario. So we have a lot on talking about global dengue initiatives. We have many different aspects to be addressed, from vector control, vaccine, diagnostics, communication and community engagement, therapeutics, policy, advocacy, and we have a lot of stakeholders taking this stage. We have WHO, of course. We have the Dengue Alliance, which I'll talk about. It was mentioned, the OCRU initiative from DenHost. We saw the DenCor yesterday as well, the Diagnostic Alliance that's being formed to improve diagnostics, both for etiologic diagnostics, but also for biomarkers development. We have this forum here, which is becoming a highlight for the dengue community. We have the collective action on dengue that joins a lot of important stakeholders that's from working on vector control, therapeutics, vaccines, and universities trying to joint efforts to tackle dengue. And we have many others that I have not cited. And how can we not compete but work together in terms of producing the tools and countermeasures we need for dengue? So I'll stop here and talk a little bit about DNDi. So maybe not everybody knows about this organization. So it's a 21-year organization that was funded with the initial investment from the Nobel Prize that the Doctors Without Borders received, trying to reduce the gap for treatments for neglected diseases. We have different funders that are listed there, and so in these 21 years, 13 treatments have been delivered. There have been more than 200 clinical trials, and there are at least 7 clinical trials ongoing right now. So it's a very impressive result for a PDP. And the way that DNDi works is more than 220 partners, institutions in more than 50 countries, and from the industry, academia, governments, patient groups, trying to have this virtual orchestra to tackle these problems. And in 2022, DNDi joined with 5 other organizations from Brazil, Thailand, Malaysia, and India, decided to create the Dengue Alliance with the focus to develop um, treatments for dengue, and with that having a strong participation of endemic countries, the expertise of these organizations and other that are invited to the working group. So we have currently a preclinical working group that is evaluating candidates and in vitro and in vivo models, the clinical working group that extensively discussing endpoints and also the study designs, a translational working group that has been focusing on trying to find these biomarkers that could be used both for endpoints but also for targeting the successful therapeutics that we want to develop, and also an epidemiology and access working group that's studying the different scenarios. As we see, dengue is very complex and diverse in different settings. And for that, we are taking the approach of investigating both direct-acting antivirals and host-directed therapies. I don't think I need to explain why we take both of them into our analysis framework, because there are different ways that it can be delivered and how we could reach a faster a result to deliver a treatment. We have different approaches. So the Dengue Alliance is focused on early treatment, so we want to prevent progression to severe disease, reduce duration of symptoms. It has the caveat of we needing to initiate the treatment early in the course of infection, but we are exploring both antivirus and host-directed therapies, and we have other initiatives, as was mentioned, led by Sophie on the host that for treatment of complications and severe manifestations, and both of them we have the need, and Jenny addressed it very well, for harmonizing the clinical endpoints, which is a challenge if we are going to look for severe endpoints. It might require enormous numbers for the clinical trials. At the same time, we are having other possibilities. They are not mature enough, but we are working with partners in trying to, and also regulators, in trying to decide on how to have this approach. And for that, we are having a portfolio approach as well to accelerate evaluation therapeutics. So we want to have an adaptive platform-based approach, and we might change a little bit based on what Jenny said and merge some of these initiatives, but we are adamant that we need harmonized clinical endpoints, and ideally we would be looking at progression to severity. We know the problems with hospitalization and the variability of practice and the subjective it may incur. And we are also working with time to sustain recovery in trying to have an intermediate endpoint that could be in the pathway of severity, and also would have many health and socioeconomic benefits. We have an interesting pipeline, so Jenny mentioned some of them, from direct-acting antivirals, the monoclonals, host-directed therapies, host-targeting antivirals. So far, the Dengue Alliance has MOU signed with the Serum Institute of India, which is a very exciting prospect of monoclonal already in phase 3, and that it's ongoing in India, and our colleagues from Serum are here, and we want to expand that to the other countries of the Alliance for that purpose. We've also signed an MOU with Hyundai Bioscience in Safety, which is an enclosamide formulation, and we are interacting with the other partners and following the pipeline to eventually incorporate them in the trials. We have a complex assessment will be very difficult to do, because we have very different scenarios for dengue from geographies, different populations that might incur different responses. Different age groups will respond differently, and we want to focus from the start in the pediatric population, but also the elderly population, and include pregnant women, as we see a high burden of disease, severe disease in this group. And then on how we can take these. We have this discussion of should we have a global trial, should we have regional trials, because of the difficulty in comparing these different scenarios in which places we will have a high proportion of elderly, in other places we only will have children. So how do we manage that? And that's something we are working on. The health-seeking behavior, how is the health system preparedness in these cases as well. So one of the other aspects that is a challenge for running the trials is the unpredictability of transmission as a major hurdle for trials. So Jenny mentioned that many trials stopped in phase 2, and part of it is because you make a lot of investment to set up the sites, and you might have a very well-structured site that had a very good experience in dengue, but then you don't have meaningful dengue numbers for the next 2 or 3 years, which is not a problem for the population, but a problem for the trial. So how can we overcome that hurdle? We are working with governments, with modeling groups, in trying to come with more efficient, targeted ways to direct resources for where we can run the trials in an affordable and also quicker way. So that's definitely a challenge, but we are working with some groups and models, and we're probably going to implement that from next year onward to have and for that the partnership with the government is key, because we can have a nationwide approved protocol that can be activated once we have cases in specific places, and that's one of the approaches we are taking to trying to come with results quicker in these aspects. So we are also working with many other groups from outside the Dengue Alliance for burden estimating. We are working a lot on trying to understand the burden estimate in Africa, and we have done a lot of work alongside African organizations and also the Imperial College of London and the Ilaria group. The preclinical evaluation, so Ashley St. John has been working a lot with us on these models, on the translational risk and stratification based on these biomarkers evaluation, and also for the clinical activities on how we can work together with the other clinical networks. So we mentioned Sophie is part of our clinical working group, and we are also involved in her trials, so trying to get most of it. And for advocacy, we are working with the collective action on dengue, so it's a very interesting initiative for that. And we were a lot involved in the discussion for the G20 foundation of the Coalition for Innovation and Local Production, for which dengue is likely to be one of the first initiatives. So trying to come with solutions for making the innovations and the production of the dengue countermeasures available where it's needed. We also are well positioned with other networks that we are working on, and not all of the countries involved are listed here. We do have to update, but trying to navigate in this scenario and how we can produce the clinical trials and the results that we need to deliver these treatments. So we are moving towards delivering that. We would like to have these first results within the next 4 years. We have got support, recently announced support from the European Union, from HERA for initiating these trials. So we are pretty advanced on agreeing endpoints in our clinical working groups and the partners in starting interaction with the regulatory agencies. We are also advanced alongside in pediatric and pregnancy plans to be included the earlier possible. We also, with the epidemiology and access working group, we want to start exploring now what would be the scenario. So for different products, we would have different ways of approaching and giving the treatment. So of course, for an intravenous treatment, we would focus on the people more at risk of progressing to severe disease, and how we can do that as a platform trial. We have platform designed to be more efficient and gather more partners for that purpose. So we will be initiating the trials next year, and we are looking forward to be discussing and interacting with many of you in this this regard. So, as a summary, dengue therapeutics are needed, and we think we all believe in this. So we believe in this potential to make a huge impact in the health systems, but also socioeconomic impact of the individuals who are affected. We still face this challenge of having harmonized and agreed endpoints, so we have these discussions to be progressing, and new things as Jenny proposed to be incorporated that. We will need to be creative and innovative to make, although we are receiving support, we will need much more support to reach what we desired, our aims. We really believe that biomarkers are necessary it will make a huge impact, both for endpoints, but also for targeted these interventions. And it will be important to have these discussions and collaboration between the different networks and initiatives to tackle dengue and customize the response in the different scenarios that we face. So that's what I had to present. Thank you.